Hey, good morning, good afternoon, and good evening. Thank you everyone for joining us for Making the Case for Micronutrient Data. This is the 20th webinar in the Data for Nutrition webinar series, and we're very excited to learn more about how micronutrient data is collected and used for decision making from today's distinguished speakers. We're also very excited to meet a new initiative from the Micronutrient Forum called the Micronutrient Data Innovation Alliance, or DInA. Next slide, please. Before we get started, here are some quick housekeeping notes. First, all participant video and microphones are muted during the presentations. You can use the Q&A button to share questions with the speakers at any time during the webinar, and we will answer as many of those questions as possible during the live Q&A session today. But then after the webinar, we'll go ahead and share a written summary of the Q&A and answer any questions that we weren't able to address today. Finally, a recording of the webinar will be available immediately on the Data for Nutrition webinar channel. Next slide, please. Thanks. Today's webinar is coordinated by the Data for Nutrition Community of Practice. The Data for Nutrition community provides members with opportunities to share knowledge, experience, and questions relevant to strengthening the nutrition data value chain at all levels for the purpose of achieving better nutrition outcomes in low and middle income countries. You can post questions and resources to our online forums, volunteer to present in a webinar just like this one today, and network with our growing community of over 1,035 members by registering today at datafornutrition.org. Next slide, please. Great. So we're really excited to hear from today's esteemed speakers. First, we'll hear from Dr. Lwin Mar Hlaing. She is currently a consultant with the Micronutrient Forum and serves as a national coordinator for Myanmar in the Iodine Global Network. Next, we'll hear from Mr. Alex Ndjebayi. Alex is currently a program advisor in Cameroon for Helen Keller International, and he joins us today with over 15 years of experience working with micronutrient and fortification data. Finally, we'll hear from Dr. Megan Bourassa, who will introduce us to the Micronutrient Data Innovation Alliance, DINA. Megan is currently the program lead for the initiative. So thanks so much to each of you for joining us today. And with that, I'll go ahead and turn it over to Lwin Mar to share a bit more about the Myanmar experience.
Thank you, Riley. Good afternoon, good evening, and good morning, everyone who are joining this webinar from different parts of the world. Today, I'll be sharing with you about Myanmar experience on advocating the micronutrient data. Next slide, please. These are the topics that I will be covered during my presentation. And next, please. Let me start with the brief country profile. Myanmar is one of the Southeast Asian countries with over 51.1 million total population. As you can see here in the graphs below, malnutrition problems are still existing inside the country as the public health problem. Anemia affecting several different target groups of the population, and the magnitudes were well above the public health significance level. So it's the same for acute and chronic undernutrition among under 5 children as well. Next, please. Given those nutrition problems still existing as the public health problem inside the country, we have been implemented 5 national nutrition programs inside the country, including prevention and control of protein energy malnutrition, iron deficiency anemia, infantile beriberi, and elimination of iodine deficiency disorders and vitamin A deficiencies. All of these 5 major nutrition programs have been implemented together with the nutrition education to the community. The reason why I said I mentioned here up to 2021 is because this program has been implemented as the nationwide program until before the military coup happened in the February last year, 2021. Next, please. So let me start with the question of, do we need the micronutrient data inside the country? And the answer is apparently yes, because we need to have the micronutrient data of the population inside the country, because we have to understand that whether the micronutrient deficiency problems are really existing inside the country, and who are the vulnerable groups who are mostly affected by the micronutrient deficiency, so that we can develop the nutrition programs, relevant nutrition programs, or modify the existing program to really address the need of the population so as to maximize the program efficiency. And of course, to monitor and evaluate our program as well as the potential risks of the toxicity. And we also need to understand the linkage between micronutrient status and the health outcomes. And finally, to track the progress of achieving the global targets such as Sustainable Development Goals and global nutrition targets. Next slide, please. So being aware of the importance of those quality updated micronutrient data, in Myanmar, we have several challenges encountered regarding the availability of the micronutrient data. We have scarcity of updated data on population micronutrient status. And given, despite we have been conducted several nutrition survey inside the country, but the availability of reports coming out from those previous survey is quite limited, and we are not sure, and there is questionable use of the survey data for implication inside the program. Because of that issue, the limited data availability, we were not able to perform effectively for tracking of our program performance, as well as participating in the regional and global comparability and visibility, especially, for example, in contributing to WHO vitamin and mineral nutrition information system. And also the same to track the country status of meeting the global targets. Next, please. So, so let me continue to share about the previous survey have been conducted in Myanmar. Previously, we have several nutrition survey, but most of them are focusing on single nutrient and mostly on the single target group in each survey. For example, vitamin A survey conducted in under 5 children, hemoglobin survey conducted in pregnant women, wider survey or urinary iodine survey conducted in school children, something like that. And also, most of the previous survey has been covered by geographic region, the 4 geographic region, taking the subsample from each of the geographic region, not really representing all states or regions inside the country. We have, for your information, we have 15 provinces inside the countries. So what about the sustainability issue on the use, sustainable use of data? The previous survey were mostly driven by the interest of the donor, which is because of we have limited sense of ownership from the government side and the program implementation side, and which was again because of we have a limited number of technically capable resource person inside the country to understand the importance of micronutrient data as well as the use of available data inside the country. Next, please. So all of these factors were driving us to conduct a comprehensive micronutrient and food consumption survey. We call it MMFCS, and we were fully aware that there were challenges inside the country, especially for advocating the micronutrient survey conduct, which is again because of the limited number of technically capable government staff or program staff to understand the importance of micronutrient data value change. Because of that, we didn't have enough driving force or power to advocate the leaders to conduct the comprehensive micronutrient survey. And again, from the leader side, from the policymaker side, they have less interest to invest in the importance of nutrition. We all know that nutrition is not a quick harvest. Despite the fact that nutrition is the fundamental component of a country's development agenda, and which is really important for the achievement of the majority of the Sustainable Development Goals. But the interest from the leaders formally was really quite challenging for us. But during the democratic government between 2015 and 2020, we have gained some of the opportunities for us to move forward with the comprehensive micronutrient survey. We were able to advocate the political leaders on the importance of nutrition, as well as the importance of having updated quality nutritional status, micronutrient status data of the population. And from the political leader side as well, we gain strong commitment and support to invest in nutrition for a long-term development plan of the country. So using that opportunity, and also we were quite lucky that we have some trained nutritionists inside the country who is fully aware that what will be the logistic preparation for a comprehensive micronutrient survey. And then finally, we got the approval from our political leader to conduct the comprehensive micronutrient survey. So the key message here I want to share with you is that if we want to have the successful advocacy for the political leaders, especially on the importance of micronutrient data, we need to have strong knowledge and skill to conduct that advocacy. And of course, the willingness to listen from the leader side is also really critical for the success. Next, please. So we have started our preparation on Myanmar micronutrient and food consumption survey since 2015. And we try to include several target groups and multiple indicators, including children, girls, women, men, and biomarkers and micronutrient status, dietary intake, feeding practices, food security, and dietary diversity. And we have conducted series of meetings involving with the coordinating body, donor, and the international expert. Next, please. So given the nature of a comprehensive nationwide survey, we have encountered, of course, several hurdles and challenges. One of the big issue is that we have critics on the inclusion of indicators. By the time we prepare for the MMFCS, the report of Myanmar DHS have been recently released. So we were criticized that why do we have to include the anthropometric data in our survey, given the fact that recent DHS have anthropometric measurement indicators. And another critic on the indicator is, of course, the biomarkers. Being the nature of the biomarker analysis is resource intensive and costly, so some people don't want to include some of the biomarkers, and some people push us to include some of the biomarkers, and things happen. And another issue is that with the data sharing, so we learned that we should have prior discussion and agreement on data sharing mechanism since very beginning. And since this is not the usual way whenever we conduct a survey, but based on our experience, I want to share with you that we need to always have the plan B for seeking the alternative donor if one has been stopped, so that we can move forward with our survey activities. So I want to share with you some of the ways that we have overcome to solve these problems. Is we have conducted several advocacy meetings, bottom up to the policymakers and the government leaders, informing them about the importance of such comprehensive micronutrient survey and the benefit we will obtain from that micronutrient survey, as well as to the top-down level, to the subnational level advocacy meeting have been conducted. And we also have in-depth technical discussion to convince the criticism and as well as to seek the funding from the donor. And we also conducted the intensive preparation, including the training of enumeration team, including the standardization procedure, pilot testing of data collection procedure, and establishment of the administrative team throughout the country. Next, please. So we have one of the key consideration during the survey conduct is about the data, the use of data, understanding of the data. I here would like to highlight that we always have to include the international expert for helping us to conduct the micronutrient survey and preparation stage, analysis and usage. The key message and lesson learned that we have gained is, in addition to providing the technical support, capacity building and strengthening of the local staff on the understanding and efficient use of data is really important. And if we have the issues with data sharing, then it could really hamper the progress of the survey. And we need to have the knowledge on the national data protection regulation, as well as the international practice on the data protection, for example, general data protection regulation in the European Union. So the key message here is, in addition to having the technical knowledge on nutrition, micronutrients, we also need to have the knowledge on data protection regulation, as well as we should have discussed and get prior agreement on data sharing mechanism since very beginning. Next, please. Coming along through these challenges that we have passed through all the challenges, and we have conducted our micronutrient and food consumption survey involving these 7 target groups shown here. And overall, we have more than 38,000 total subject and from over 27,000 households included in this survey. Next, please. These are some of the photos that we have taken during the training as well as the data collection activities of the micronutrient survey. Next, please. And the data collection activities have been successfully conducted between November 2017 until May 2018. And the interim report of the micronutrient survey has been released and disseminated in February 2019. And the final report has been finalized by end of 2020, and which has been endorsed by multi-ministry coordination body by the end of 2020. We didn't wait until the results from the final report, which include the biomarker analysis. We have applied the findings from our interim report for the development of multi-sectoral National Plan of Action on Nutrition. We call it MSN-PAN. Next, please. So we were fully aware that to tackle the multifaceted nature of malnutrition problem, we need to engage and involve multi-sectoral approach. So we have made sure involvement of several stakeholders relevant to nutrition in our MSN-PAN, including government ministries, UN organizations, development partners, local and international NGOs, and the private sector, with the overall goal of reducing all forms of malnutrition in mothers, children, and adolescent girls. So I here would like to highlight some of the points again for the lesson learned on the use and availability of the micronutrient data is we really need to have the enough number of technically capable local staff so that to understand the importance of micronutrient data value chain, to effectively advocate to the policy makers, government leaders, as well as the sub-national level, and also successful collection of the data collection activities and efficient use of data for policy making, program implementation, monitoring, and evaluation. Given the nature that different donors have different interests, we also need to have the skill to convince and advocate them so that we can have smooth communication and conduct of our survey. And of course, we need to have prior discussion and agreement who will do what in the survey, and also should have the knowledge on the country's regulation, international practice on the data regulation. Next, please. With that, I would like to end up my presentation by sharing with you some of the photos that how we have come up with the advocacy on micronutrient data and also the nutrition with our political leaders. On the top left side, we have advocacy with the State Councillor Aung San Suu Kyi, as well as the advocacy on nutrition among multiple ministry, donor agency, parliamentarian, and sub-national level, of course. Next, please. Next, please. Yeah, with that, these are the references that I have used for my presentation, and thank you so much for your kind attention. And now I would like to hand over to Alex for your presentation, please.
Thank you, Lwin, for your nice presentation. Thank you for all the information you shared. I will present now the second presentation of this webinar, which is the micronutrient data utilization with Minimode. Minimode, which is the micronutrient intervention modeling tool developed by the UC Davis University in collaboration with Helen Keller International Cameroon and the Ministry of Health and all the affiliated universities locally. So the presentation will be focused on how this tool helped Cameroon to use micronutrient data and to develop some policies. Next, please. So the overview of the presentation will be clearly presented as you see there. After the presentation of the Minimode story in Cameroon, we go through the main objectives, some examples, positive change, challenges, and some lessons learned. Next. Yes, what I can say is that for the implementation of Minimode in Cameroon, there have been three main steps, which have some many small tests, small steps. The first was collection and generation of accurate data. As you know, in our low-income countries, there were not a good awareness of the using of data and the importance. So we developed it between 2009 and 2013. After it, we started refining those data and generating first results of Minimode simulation and assessment of some needs. And finally, since 2017, we started popularizing and use of tool for the generation of evidence and data to inform decision making for decision for the nutrition in Cameroon. Next. Next, please. Is it the next? Okay. Oh, no. Come here, please. It went too quickly. Okay, so the main objective of tool used in Cameroon was to generate estimates of inadequate micronutrient intake and hence the needs, get a better sense of the magnitude and spatial variation of inadequate micronutrient intake in women and children in Cameroon, model the effects on prevalence of inadequate micronutrient intakes of a wide range of micronutrient interventions independently and jointly, estimates the cost of alternative micronutrient interventions programs independently and jointly, identify cost effectiveness of program interventions nationally, subnationally, and over time by combining information on the expected benefits and the cost of intervention program. Use the results in policy discussion about the control of micronutrient deficiency to influence decision making. Next. That's where the main objective. So we did a lot of work since 2009, as you can imagine. I will just share some example of the use of minimal results in Cameroon. Next. Yes, the expected results of the advocacy for monitoring, of what we can say nutrition programs in Cameroon, where the meeting of the National Food Fortification Alliance are held regularly without waiting for funding from a partner. It was a need when starting this work with the minimal tool. The fortified food monitoring system is integrated into a routine food quality monitoring system by Ministry of Rural Health, Trade and Industries. The data from the various monitoring missions and surveys studies carried out within the framework of the fortification are taken into account into the decision-making process. Model use key point. The model was useful in strengthening advocacy for better monitoring of food fortification program. That was the first result of an example of the using of the minimal tool in Cameroon. Next. Yes, this is one slide that can show how children have been covered using the minimal tool. We see that according to the food for the oil fortification level achievement by the industry, we also have a high level of children that are touched by the food fortification program. This is monitoring data that we used 2012, 2013 in Cameroon. Next. In this slide also, you can see how the model can predict the number of cases of anemia averted among women to increase fortification of wheat flour with iron in Cameroon. We did 2 surveys, 2012, 2016, with different target populations touched, and you have the effect of anemia averted when the fortification is well conducted. This helps us increase the awareness of the decision making in the fact that we need to increase the quality of the program to have a better effect. Next. You also have the better results of advocacy for coordination, because there were some problem of coordination of nutrition program in Cameroon, and the various actions for fortification vitamin implementation to combat micronutrient deficiency are monitored in a coordinated manner and are no longer treated in parallel. The data resulting from the various actions of the partner are shared and discussed in a collegial way. Concerted actions are carried out in areas where several partners are implementing, and the micronutrient control strategy planning consider the contribution of all interventions over the space and time. This was what expected results of the minimum node tool in Cameroon, because things were working in parallel. Next. And this is one example of what the simulation of the mini-mode help us to get in terms of meeting the nutritional needs of children in macro region in Cameroon. So you have the effect of improving vitamin oil fortification among population, and the fact that you can choose a package of intervention that will solve the problem of inadequate intake of vitamin A. This figure showed us that the intervention package could solve the problem of inadequate vitamin A intake among children in the southern region of Cameroon. Next. You have the same figure in the northern region. This same fortification program can reduce but cannot solve the problem of inadequate vitamin A intake among children in the north region of Cameroon, according to several aspects taken into account in the minimal tool. We found that it would be better to add another interventions in the northern region because the one we are conducting there cannot solve the problem. This is due to the simulation did with the minimal tool. Next. Okay, so some other result has been found. So the model can also be used to estimate subnational program efficiencies. As you know, our countries have different climates, different food habits. So distribution cost of high dose vitamin A capsules annual per child change or are different for some region to another, and the minimal tool help us to have the cost in this figure, depending on the region, and we can see that in the southern region the cost is highest than in the extreme north region, which is at least 3rd time less. Next. That's what exactly I wanted to show. Okay. With all this result, with all this advocacy, with all this meeting, with all this analysis and simulation, we finally get some positive change in the management of nutrition programs to which Minimode has contributed in Cameroon. Next. First of all, the strengthening of intervention quality assurance for nutrition interventions program. So a monitoring and evaluation plan clarifying the role and responsibilities of fortification control institution has been developed to strengthen the performance of the fortification through a stronger monitoring system. So we found that it would be good to have a strong monitoring evaluation plan clarifying the role. The NFFA coordination meeting has budgeted by the Ministry of Health to ensure that they are held regularly. In the past, this meeting were financed by partners like Helen Keller, UNICEF, and now, due to our advocacy, now the ministry is financing, budgetizing himself this important meeting. Next. Secondly, the importance of having data to better monitor. So we have a positive change in the management. The importance of having data to better monitor the performance of intervention is recognized and integrated into practice. So market surveys, coverage surveys, and follow-up missions were conducted as part of the fortification program. Data from post-event coverage survey of vast administrative coverage data are now used to strengthen the system. Ongoing discussion to redo a food consumption national status assessment survey nationally to better understand the performance of intervention and change the national needs of the population since the last survey of 2009 has discussions are on the ongoing stages. This means that data becomes important for the decision makers, and they are also funding some of them and using the results to discuss and to better understand the performance of project. Next. In the same way, the cost of nutrition intervention is taken into consideration when planning a new interventions or in discussion aimed at making programs more sustainable. Larger part of the budget supported by the state. For large-scale fortification, the program monitoring and evaluation plan has been budgeted in details to facilitate its inclusion. The composition of the NFFA has been revised with smaller number of permanent participants to be integrated into the state budget more easily. So now, for some important project of the government is funding it. This is really a huge goal, a huge objective achieved by the project, by the partner, even by the nutritionist, because they were used to wait money from partner to conduct anything. Next. Another positive change is all the actions to combat micronutrient deficiency are discussed in the multi-stakeholder group. Life-skill fortification is a regular topic of discussion within this technical working group on micronutrient, no longer covered separately. So we create an enabling environment for discussion of micronutrient issues in Cameroon. The mini-mod hub, which is the sort of task force using these simulations and data from mini-mod, has strongly supported the creation of this technical working group. In this group, all issues related to micronutrient are presented, shared, developed, and discussed with micronutrient partners. So there is no longer separate meetings to discuss about specific projects. All the micronutrient projects are discussed in the same place because we found that data are important to share and to discuss about it. Next. So to achieve all this was not easy because there are some challenges that we are still occurring until now. So long-term work, several presentations were necessary to ensure understanding of the tool and leads the actors to have an integrated vision of the fight against micronutrient deficiencies and to take an interest in the cost of the intervention. This was too long. After that, we started in 2009. It's almost 12 years, 13 years now that we started discussion about that. And it's now that we are starting having some results from these decision makers. Difficulties in obtaining information concerning the coverage of the cost or the cost of the interventions, because sometimes in the government, it's not easy to have costs. They are used to do things like usual, and it's difficult to get some information about that, to simulate, to anticipate, to predict. The actors changed, and the presentation had to be repeated from the beginning several times. So when a director change in the ministries, we are obliged to retrain the new director and his new team, and sometimes not easy. Sometimes certain needs emerge, and the time to respond to the request was short. Now in Cameroon, sometimes when the director needs to go to a meeting, important meeting, he asks the minimal help to help him having some simulation about specific interventions, and this can be challenging when we don't have enough time. Next. So some lessons learned. I hope I'm still on time. So we need to be perseverant, and repetition is needed. Do not hesitate to repeat, because sometimes it takes time to understand about where we want to go. An intermediary is needed between the country and the modelers to facilitate exchanges. Helen Keller played that role, and now we have a minimal hub in Cameroon. Some scientists, some universities are very interested in those. Even in the Ministry of Health, we have some health specialists that are interested in this work. Paying attention to cost is essential to ensure the sustainability of interventions. It's really important. Organizing workshops for collecting information is sometimes necessary. For example, workshop to budgetize the monitoring system. It is desirable to coordinate with other models producing evidence. In Cameroon, we have experience with optimal nutrition, the FNG tool, also of the WFP, to better explain the difference and give complementary messages. Yes, because sometimes we need other results to make a big view of the situation in the country. At the beginning, it is important to create a core group of partners who develop a deeper understanding of mini-mode and who can later support the use of mini-mode. The questions and criticisms of the partner in the small group helped to improve the analysis made from the tool. Next. Okay, I wanted to thank all these partners. Certainly, I've forgotten some, but as I said, we worked strongly with all these partners: Ministry of Health, Cancer Foundation, Site Life, UNICEF, and UC Davis, which is the founder of this InMo tool. I want to thank you. I hope I'm still on time. I think I will pass the word to the next presenter. Thank you very much.
Thank you so much, Alex and Lwin Mar, for your presentation. These are some really nice cases where micronutrient data surveys and the data themselves were used to inform future policies and programs, although certainly not without a series of challenges. So I will be presenting today about the Micronutrient Data Innovation Alliance, which is a new project of the Micronutrient Forum that I hope will be able to help support some of these types of projects in the future. Next slide. So we all know that micronutrient data is essential for making informed policy and program decisions for nutrition interventions, but this doesn't always happen in the way that we would like. We often hear that the reliable data are sparse or lacking, but it's not just about having more and better data. We also need to make sure that the available data are better analyzed. And when they are analyzed, such as in the Cameroon example, that they really reach the right people to make sure that national level decision makers are able to make informed decisions based on available data. The examples that we just heard are really quite nice success stories, and it would be nice to have more of these in the future, and hopefully this is something we can support. But I also want to point out that these cases took a lot of advocacy and quite a lot of time, as they both pointed out, to really advocate for the data collection and then the data use. But they really were the result of sustained advocacy and persistence by the in-country team. Next slide. So we would really like to see a strengthened or improved data ecosystem for micronutrient data and large-scale food fortification. This ideally would support national level decision makers who need more accurate and timely data, the ability to interpret and analyze the data, as well as the capacity and means to design, implement, and scale up programs. But in order to do this, we feel we really need the field to align on data priorities and to be able to implement changes in a coordinated manner. Next slide. So this is what we hope DINA will do, and our approach for the Micronutrient Data Innovation Alliance is to create an alliance of diverse members who coordinate together to improve the availability, quality, accessibility, and use of data across the value chain to support national level decision makers so that they can better design, implement, evaluate, and optimize their nutrition programs and policies. Next slide. So we are envisioning DINA taking 3 different themes. One is the global level coordination and guidance. So this is to help fill any gaps in guidance or best practices. We know that there's a lot of tools out there and guidelines, but making sure that these are updated and are widely disseminated among the community. Next, we would also like to focus on some national level support and advocacy to really help support decision-making around large-scale food fortification or micronutrient data collection. We'd also really like to make that data investment case. So, of course, it costs money and time to collect data, but then the return on that investment, once you have a better picture of what's happening in various regions of the country, and you can better plan your nutrition interventions. And so hopefully we can make the case that can support advocacy efforts in various countries. The third component of DINA will help to facilitate data exchange and dissemination. So where possible, we'd like to foster and facilitate data sharing, particularly at the global level. And then also, as new surveys are conducted, we can help disseminate some of the information and the lessons learned. And hopefully this will help to feed into future analyses and advocacy for more data in the future. And then across all 3 of these themes, we want to focus on gender and vulnerability to make sure that as we're collecting data, we're including the most vulnerable groups so that we can better design and support programs to really target these groups who really stand to benefit the most from potential interventions. All right, next slide, please. So DINA is just a little under a year old, but we have a number of initial projects that we hope will get us started on a longer term plan to support the micronutrient and data large-scale food fortification data ecosystem. The first project we have is to create a lexicon of data terms, and this is something Lwin Mar has been working with us on to really help make sure that we are able to speak a common language and that the definitions are clear to everybody. This can also help facilitate newcomers into the field to make sure that we're not speaking too much jargon. So we're currently seeking feedback on this project, and I'll get into more details on the next slide. But the other project that we're working on is to coordinate some of the global data groups. So I'm sure you're aware that there are a number of groups out there similar to DINA who are working with the same objective of really fostering a better micronutrient and nutrition data ecosystem. So we're working with them to synergize our efforts and to avoid any duplication. Hopefully we can be stronger together. So this is really an ongoing project that we have. And one of our collaborators is the DInA group that also is behind the Data for Nutrition team that's running this webinar. The next activity that we're working on is a series of case studies for micronutrient data. And so this is really similar to the case studies you heard today. We really want to showcase and promote some of these good examples where the advocacy was there and really that sustained effort made it over the finish line for each of these projects. So we're currently identifying cases. If you have any suggestions, I'd be most interested in hearing them. You feel free to email me. I'll have my contact info at the end, or just put it in the chat. We're also working on a root cause analysis to better understand some of the barriers to micronutrient data collection, analysis, and use. And what we really hope is that this will inform some of the longer term activities of DINA. We want to make sure that the projects we are embarking on are really going to be useful in fostering more and better data to make decisions. And lastly was that data investment framework that I mentioned on the previous slide. And this will hopefully help to demonstrate the value of micronutrient data. And this is something we're planning for the next couple of months. So next slide, please. I just want to take a minute to go a little bit further into the lexicon because we could really use your feedback. So right now it contains about 115 micronutrient and large-scale food fortification data terms. And these were compiled from a number of sources, including WHO, GAIN, NI, and the scientific literature. We'd really like to see this be a living document that lives on our webpage and can be continuously updated as new terms become available or definitions may need to be modified. However, we have about 40 terms that have multiple definitions. And so this is where we could really use help in identifying a consensus around which definitions we should be using in the lexicon. So 40 is an awful lot of terms to ask anyone to review. So I've divided them up into 3 different categories based on what type of term they are, whether they're food fortification, QA/QC, or more nutrient and biomarker terms. So if you have a moment, please click on one or more of the survey forms and help us identify a consensus on these different terms. So that would be much appreciated. Next slide. So there are a number of ways that you can get involved in DINA, and I hope that you do. You can join as a member. It's free to join. We have organizational, individual, and observer status, depending on what your organization's preferences might be. You're welcome to join as either one of these. And this is really the best way to stay engaged and informed on what the program is doing. If you have already applied, I received a message in the chat already. We have our first steering committee meeting next week, and so we'll review all of the membership applications and we'll be getting back to everyone shortly. I really appreciate your patience. I know it's probably been a little longer of a wait than we would have liked, but we'll be getting there. You can also sign up for our newsletter. This will keep you informed of all of the activities that we're working on. Of course, help with the lexicon. And we just recently created LinkedIn and Twitter accounts, so you can follow us on either of those platforms. And if you have any questions or comments, please feel free to contact us at DINA@micronutrientforum.org. That'll pretty much go straight to me. So if you do have any feedback, please let us know. And next slide. So thank you all. And here's some of those details as well with our contact information and ways to connect with us. So with that, I would like to thank you all for listening, and I would like to turn it over to a Q&A session so that we can ask all of our speakers the questions that have come in. If you do have any additional questions, feel free to put them in that Q&A box chat there, and we'll go through them. I think we will take the first question, and I think Lwin Mar has volunteered to answer this question. It asks, of course, we know it's important to include biomarkers and micronutrients in data collection, but the efforts to improve on the analysis front and making sense of these expensive data collection exercises. So how can we make sure that we make the most of the analysis of these efforts? Lwin Mar, do you want to speak to that? I also hope that the Cameroon example helps provide some examples as well. Go ahead.
Yeah, thank you, Megan. Thank you for this question. That yes, of course, we should have the prior plan of analysis since the stage of the protocol development. This is just to share with our Myanmar experience on that. We need to have the plan of data analysis plan well advanced so that we can make sure that which data will be analyzed in what way and presented in the report. And also highlighting again, in this case, is the capacity building of the local staff to do the efficient and effective data analysis is also important. What we have planned is we will use the data for the master and PhD students inside the country to improve their understanding of the micronutrient data as the way to do the capacity building. But unfortunately, because of the situation happening inside the country, we cannot proceed with this plan yet for the data analysis for the student, I mean the postgraduate student. And regarding the effective use of data, we really need such kind of data for our program implementation. Of course, some may need for food-based approaches, some may need for fortification or supplementation, but all of these information, of course, we can get it from the micronutrient survey. This is what I want to share with you to make sure that the data collection exercise as well as the data analysis. Thank you, Megan. Over to you.
Great. Thank you so much, Lwin Mar. We also have another question. This one is for Alex. And it says, regarding the cost per child according to the regions for the 2 doses of vitamin A capsules, what are the determining elements by region? So what's really swaying the cost considerations there? Alex, are you able to hear us? You might still be on mute.
I just had a call. What is the question, please? I just had internet problem.
Sure. So what are the costs per child according to the regions for 2 doses of vitamin A capsules? And what are the determining elements by region for those costs?
Thank you for the question. I think in one of my slides, I've presented the cost per region. Cameroon has several micro-regions, which some are mainly as Sahelian with forest side. The other side of the country is like is a forest side of the country. So according to this different environment, we have different food habits and different availability even of food. And according to the survey, for the specific vitamin A supplementation project we had in the far northern region, there are 10 regions in Cameroon, and each region has its cost according to the different parameters like the density of population as this is the main point, and the more children affected by the children affected by the interventions, and the population density also. These are the 3 main. We also have some logistic cost, because in the minimum tool we are taking into account all the cost relative to the intervention. So the far north region, to reach this region, you need to have a strong logistics, and some regions are less populated in terms of populations like others. So the cost for the highest cost for the vitamin expedition is $2.05 per children, and in the far northern region we have the less cost, which is 0.66. So for these specific interventions, the main reason is the density of populations. That's what I hope I've replied to the question. Thank you.
Great, thank you so much. And I also see Anne's replied to that in the chat as well. Another question that we have, I think I might be able to answer, is will there be a repository of data collection methods? And yes, ultimately we would like to have on our website at least links to other sources to help support micronutrient data collection and analysis. If those sources need a new home, we'd be happy to help with them. So there's a couple that we know have kind of run out of funding, and so we're hoping to compile some of those to make sure that all the effort that went into biomarker information and other data can be maintained as a repository on the DINA webpage.
Okay.
So I see one more question for Alex, and this might be another kind of future question, but if there's any trend analysis on how Minimod is helping to reduce micronutrient deficiencies over time in Cameroon to inform integrated micronutrient programming adjustments.
You're asking if there has been a training, does it?
Yeah, like any follow-up information or I guess data collection since then.
Yes, because Minimod is not the tool making the survey. It's just Minimod is using the data from surveys, from the available surveys. And when data are available, we introduce it when micronutrient data are available, we are introducing it into the model and try to run it according. And mainly, the request comes from the country, from the users, because the Minimod tool can do many types of analysis, but according to the information we need, we go through it. Yes, local scientists have been trained to better understand and having this knowledge on Minimod tool. And now in Cameroon we have a task force which is still working on it. Every time that we are doing a survey, we try to introduce data in the Minimod tool. The latest was the coverage surveys of food fortification that help us do some simulations. So the process is ongoing, it's not finished. We are still working on it, and with UC Davis continuing supporting technically. And when there is a survey, I've told you that it is planning to have a national micronutrient survey. We are still seeking for additional money because the government is willing. But when we have it, we'll update it. We will update the data in the Minimod tool to have more fresh data, because data becoming to be old. It's been 10 years now. That's what I can reply. Thank you.
Great, thank you. I think I'll ask the next question to Lwin Mar, and it says, regarding the data collection, how do you plan this data collection? Encouraging the implementation of digital tools that collects fortified data. I imagine, making sure we're using technology as best as possible. But this also links to another question I wanted to ask you, Lwin Mar, about how the survey team was organized and the training of them and the process that you undertook there as well.
Thank you, Megan. Thank you, Anna, for the question. For the plan of data collection, as I presented in the presentation, I've shared in the presentation that we started to include which will be the indicators that we want to include in the survey. So we started with, given the fact that we have scarcity of micronutrient data, so we have seen the problems that we have limited knowledge on the current micronutrient status data. So based on the target group, for example, under 5 children, we have included for biomarkers for iron, vitamin A, zinc, and inflammatory markers, and the worm infestation. And the other group as well, for example, pregnant women, we have vitamin D, vitamin B1, folate, and so on. Based on the target group and the problem, we plan for which biomarkers will be included in which target group, which biomarker, which target group, and also the dietary intake assessment as well. So we plan with that, and we have also assigned some of the survey, the team, laboratory teams, which laboratory will be analyzed, which biomarkers, and so on. And this is how we plan for data collection activities. And for the enumeration team, since we have 15 provinces inside the country, and the sample size, as I already mentioned, more than 38,000 total subjects, including 7 target groups. So we have about 120 enumerators throughout the country by each and every state or region. So we started with administration team training for the data collection activities, so that the administrative team also aware of what will be the data collection procedure, what will be the logistic arrangement for the transport of biochemical samples to the laboratory. And after that, we have continued with the data collection activities training for the enumeration team. Again, admin team also included in that training for overseeing and how they can support during the data collection activities. This is how we come up with the data collection plan and also the team organization. We have enumeration team and we have administrative team at each state or region during the survey conduct. I hope I did answer the question.
Yes, thank you so much. I see we are running short on time, so I will end it there. But I want to thank everyone for joining us, and I will pass it back to our host, Jonathan, for just some final words.
Thanks. Thank you, Megan. Thank you all for participating in today's webinar. We would like to send a special thank you to our speakers, Lwin Mar, Alex, and Megan. A recording of this webinar is available now on the Data for Nutrition YouTube channel. Copies of presentation and summary of the Q&A will be shared on the webinar's group page in the coming weeks. For more information about DINA, please visit their website on the micronutrientforum.org. Be sure to follow them on Twitter at MNData_Alliance. Thanks again for joining, and have a good rest of your day or evening.